Let's talk about birth control pills and effects on fertility. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. Does birth control pills affect long-term fertility? The answer is not really. It does prevent your fertility while you're on it, and you get older while you're on it, but it specifically doesn't affect your future fertility. How soon can you get pregnant after stopping the birth control pill? The truth is most women can conceive quite quickly after stopping the birth control pill. Within 1 to 6 months, you should be able to get pregnant, and very few women have what's called post-pill amenorrhea. It occurs in only a couple % of patients. So if you're trying to get pregnant, when should you stop the birth control pill? The truth is, as soon as you stop the birth control pill, you could get pregnant. Some people might need some time for their cycles to regulate, so it really depends. If you aren't ready to be pregnant, when you stop the pill, you might want to use a backup form of contraception like condoms until you figure out if your cycles are regular. But honestly, once you stop, just be prepared to be pregnant within the next month, although it might take a few months just because in nature it might take up to 6 months to 12 months for some people to conceive. I'm often asked, can birth control pills mask what's happening with your fertility? And the answer is yes, because when you're on birth control pills, the hormones of the birth control pills can override what's happening with your ovaries and hide if there's diminished ovarian reserve, if there's ovulatory dysfunction, because you're replacing your hormones essentially by taking the birth control pills. A lot of times people ask, what are some tips to track ovulation after you stop the birth control pill? And I would say using an ovulation predictor kit is a pretty easy way to do that. You can start using those kits as soon as the first cycle after you've stopped the pill. You can also look for symptoms. You might notice more mucus discharge around the time of ovulation. That typically means that you're ovulating, and you should be getting a period about 2 weeks after that. When you use a kit, if you get a positive on your kit, that day and the next day are your most fertile days. So when should you see a fertility doctor after stopping the pill and you're not getting pregnant? It depends if you're cycling or not, but certainly if you've waited 3 to 6 months after stopping the pill, especially if your cycles aren't regular, it's probably worthwhile to consider seeing your fertility specialist or at least a gynecologist.